Hello, am I visible? Hello. Yeah. Okay, so today we are here for a very interesting and very important thing after NEET, especially for those who are not giving NEET per se for a PG seat, or that they are confused that whether they want to go for Army Dental Corps, or they want to go grab a PG seat and they are interested in going for a specialty. And uh, so for those who are confused and those who are not planning to do so, Army Dental Corps is the option that they have basically after giving NEET. So yeah, I just have a very short this thing discussion over what you're gonna face. What are things which you have to keep in mind while you're going for the same, and yeah, how do you deal with it, and what are the important points that you are gonna important things that you're gonna face. Okay, so we'll be starting with that. So let me share my PPT. Just a sec. Okay, I hope my PPT is visible. Okay, super. So the discussion today is about the route to your Army Dental Corps. Okay. So first things first. So whenever they are calling for interview, before we get there, earlier there used to be an option that you had to tick during your need forms. But I think later they removed it, and you are automatically considered by default for a ADC process. But I want you guys to keep an eye for those who are attempting it this time and those who are gonna attempt it next time. Always keep an eye if there is an option that you want to consider Army Dental Corps after giving NEET. Sometimes there is an option that you have to tick. Without that, you do not qualify. Okay. After you have ticked the option and not ticked the option, or if they didn't have the option, because once they had, once the other time they did not have. So they will, in any case, give you a form after the NEET results is they are out. They'll give you a form to fill, which is a very cheap form. It is a 50 or 100 rupee form that you need to fill, even if you have ticked the option or not. So make sure that you are looking after it, and without that form, you are again not considered for the same. Okay, so keep an eye on it. Once you have filled that form, it is on official ADC site, Army Dental Corps site, and you fill that form and make a profile about it. Okay. So once you fill the form, there is an official circular which is released, which tells you the basic things that they are opening up the vacancies, and they'll tell you the vacancy number. This time, I think it was 30. So the rule says that they're gonna call 10 times the vacancy. Whatever X, let X be the vacancy, they're gonna call three times that number. And uh, for that to be considered, you might fall into it, you might not fall into it. My option would be, I mean, my recommendation would be to fill the form anyway, because it is not a very expensive form, right? You're giving 3,000, 4,000 bucks for your need form. If this is a 50, 100 rupee form, fill it anyway. Okay, even if you think, okay, my rank is 6,000, 5,000, 4,000, 3,000, I'm not gonna make it. It's 2,000, 2,500. You think you're not gonna make it anyway, fill the form, because you never know how much seats they will release. So this thing, how much seats they'll release, they might inform you after you have filled it, after the like vacancy is out, or they might inform you beforehand also. That can also happen, but you never know how many people are filling the form this time. So maybe you are expecting, okay, you might not qualify, but then also you might get qualified because this time people did not go for Army Dental Corps. Okay, how many seats, how many vacancies will be there is entirely dependent upon how many people are doctors are retiring this time. Their short service commission is getting over, right? So you understand that this is a short service commission. This interview is for short service commission. After that, you have to give the exam for permanent commission. Okay. So they are gonna call 10 times the vacancy. So for an example, 30 vacancies are there. They're gonna call 300. If I tell you the ideal range where it's gonna fall, you might expect with 30 vacancies, you might expect anywhere between 1,000 to 1,500. I mean, it could be more, plus minus 500 is always there. But what trend that I've seen is when I gave the first interview and the second interview and the third, which I filled, I realized that more and more people are applying for Army Dental Corps because it gives you a better future, better lifestyle. I won't say better future. I mean, future can be person to person, but uh, quick salary, quick better salary, I would say. So a lot of people are applying, seeing the scenario after the DDS, right? So it will fall anywhere between 1,000 to 1,500. They're gonna call. So once they call for an interview, so there would be batches of interview, right? So first day they would have like 10, like 25 people, 30 people. Next day they're gonna have, for an example, they are calling 300. So they might divide it into 30 batches. And from every 30 batch, they might take up 6 to 7, or like they have to take 10. So in a group, they might take only 6 to 7. In the next group, might take more depending upon the how the interview went. So that night, the night that you give the interview, that night, that evening itself, you'll get to know whether you have qualified for the next round or not. Okay, and that is going to be medical, which is going to happen next day only. So once that is done, then you are free. Then you have to wait for the merit list to come. The merit list, for an example, there are 30 vacancies. Then imagine that the people who would be qualifying would be 30, but they generally take out the list of into two, I mean 60 people, or they might take out entire the list of 90 people sometimes, depending, because they are basically relying on that some of these people might fail in the medical, because this merit list is entirely based upon the interview and not the medical which happens the next day. Okay, so I hope you understand. Vacancies into 10, they'll be called for the interview. Medical, each day, depending upon the vacancy, they'll select. Um, Hello, Mashishta, please can you mute yourself? Okay, Mashishta M, kindly mute yourself, or to all the participants, I would say, please mute yourself. Okay, okay, so, and that is what is gonna happen. Okay, so the next thing that you're gonna see is that you should know is what is Army Dental Corps. I hope I don't have to explain it much in detail, because all of those who are feeling or interested in this, they already know that this is a corps which serves both the like all the trifecta, uh, Indian Army, Air Force, and Navy. You get to decide after you have qualified for the same, and you get to decide then, or they offer you different branches. Okay, so what they demand is professionalism, integrity, and discipline. So you are both a doctor and an officer. So you have to maintain the decorum of the both, and that is what they're expecting in an interview, right? So understanding the selection process, I have already told you the gist. Shortlisting is based upon NEET MDS, your ranks, okay? And then there is an interview which will qualify, which will give you the merit list. And in that merit list, whoever qualifies for in the medical gets selected. Whoever disqualifies in the medical, you in that medical also you get a TR and a permanent rejection. Okay, mostly you get a TR. TR is temporary rejection, in which you have to get it rechecked, and in the army hospital only, they will give you a 3 months time to get it rechecked. For an example, never go with braces on. Okay, and this medical examination would be dental and medical. Okay, so in dental, never go with the braces on. It is you are directly failed. Okay, you get a TR, you get your braces removed. They give you a time of 2.5 months. Some days there are there. I don't remember exactly. They'll give you the circular, and in that you will have the detail. But it's around 2.5 2 months. You get to get your medical examination done again. And if you are like qualified, if you're good to go. Then you are again considered in the first merit list. For an example, 30 vacancies are there. You are 24th, you get a TR in the medical, which happens the next day of the interview. You again go for a medical, you qualify in the medical, then you are always considered. But if you do not qualify in the re-examination of the medical also, then I'm sorry, then you do not qualify. And even though you have cleared the merit list, you are not considered for the position. So you're not considered for a short service commission. Okay. Okay. So this is very important. What happens on the interview day? So interview day, always remember that it is very, very early morning. It's there mostly in R&R, although the venue might change, but it is mostly there in the R&R. And it is very, very early morning. Reach absolutely on time. You are judged the moment you are entering. So do not, make a chaos or something like that. Don't be late, because then again, army is known to be on time, and then you as a candidate are reaching late. You might not be allowed to enter, or you might be allowed to enter. So what happens is that as soon as you reach the gate, your parents are segregated. You all guys form a line and go to the male buildings. Your parents are not allowed to enter. Also, a big suggestion and big advice. The mistake that I did in my first interview, what happened was that it was during COVID time. So all the COVID related things, I thought I'll revise a few minutes before the interview so that it remains in my mind, right? But as soon as you reach the building, your bags, your phones, everything is collected, and you are there on your own. You are sitting idle. There's nothing with you. You cannot revise. Nothing can be done. So, okay, do not rely on that day itself. Ki, okay, I'll revise before the interview. Uh, so once the bags and everything is collected, you are sitting in a common area. After which you will be given the food coupons, because you'll be there the entire day. So you'll be given food coupons so that you have something after the interview or before the interview, before whatever you like. My advice would be to not go before the interview. Of course, I hope you will not be going, because you never know when you're called, right? Any which way, you cannot go, because you from the common sitting area are taken to an auditorium, okay, wherein you will be given just about ADC. So anyway, I'm not telling, because there a young officer would be there. Sir would be telling you everything about ADC, what it does, and how does it serve the army, where all it serves, everything will be given. A very smart officer would be there and would be telling you about that. So there's no need, absolutely no need for me to telling you. Okay. So you'll be taken to the auditorium. You won't be allowed to leave any which way. You can have water, of course. It's just outside. And yeah, so you reach there and you sit idle after that. Okay, that is something also which impacts you psychologically, because you will be sitting there from anywhere between 2 to 4 hours. Like you might be called for the interview early if you're lucky, because you'll be then be sorted within 30 minutes or 1 hour or so. But keep in mind that you might be sitting there for 2 to 4 hours, because the interview panel also goes on lunch, and you might have your interview then. If it goes for lunch, then you're asked to also go and have some meal before the interview panel comes back. So that is also not a problem. Okay. So, and also I would like to tell you, for an example, you're a lucky person, you're called in first 1 hour. Always remember that medical is separate, but your height and weight is measured before you go inside. Okay, before that, once you're called for the interview, first you'll go to a room wherein your documents will be verified. So always carry all your xeroxes. I think two xeroxes are asked, and then carry your passport size photographs, carry all your originals, whatever the list is given according to that. Always maintain a good file, I would recommend you that you get a pocket file. You understand? Wherein there are separate pockets, because you might get nervous at that point of time, and might because I had seen this in front of me. A candidate was there and he got so nervous that his entire folder fell. All his papers were lying around on the floor. He had to collect it again and give it, and that became a very humble jumble process. So after that, they take your height and weight. So any other certificate you might be thinking, okay, I'll carry my co-curricular and I'll tell them about it. Well, that's not gonna happen. You are not gonna carry your co-curricular certificate. They are not gonna take that into consideration. They'll just staple your Xeroxes along with your photographs and then write the height and weight on the first paper itself. So that leads me to believe it led me to believe that it is given some weightage, at least, if not all, because your medical is going to be next day. If you're not qualifying for height and weight, then it doesn't matter whatever interview you give. Okay. Okay, how to sit, wish, and interact. After that, once this is done, you'll be asked to sit on a chair outside the interview room. So you will be two or three candidates outside. So one by one, you'll go. So anywhere outside, also you might have to sit uh, for 20-30 minutes at least before you go inside. Okay, so keep your calm, be very confident. You don't have to feel nervous. You can have water whenever you want. And I would just advise you to be very calm and not think about the other person. Oh, he came back so early. Oh, he came back so late. The way we behave in Vivas, you don't have to behave that way. Okay. Anyway, you're going to be officers. If you do, then you have to behave in that way, of course. Okay, so before you enter, either knock or ask once uh, before entering. Okay, when until unless they ask you to enter, do not enter. Absolutely. So this is the picture. That is what you might face. So it'll be a good number of there will be a good number of members in that panel, anywhere between 8 to 10 members. They will include, they'll be from Air Force, they'll be from Navy, they'll be from Army, and then obviously the head of the panel, mostly the ADC head, sir, is there. And so, yeah, this is what you're going to face. I put this picture deliberately in this PPT because I want you to feel very normal when you go there. Okay, this is something that I'm gonna see. I'm well prepared, nothing to be worried about, because for some people it might be overwhelming. I mean, it becomes difficult for some people to give a viva to a single teacher. 8 people sitting around might overwhelm you, but nothing to be overwhelmed about. They are gonna ask you one by one, and they are gonna be very, very patient. I would say this: they would not want to pounce upon you like your teachers might have been. They are gonna be very, very patient. They are gonna be very, very gentle, because they are officers, they are army officers, they are trained that way. So nothing to worry about. Okay. So kindly enter after permission. If there is a ma'am sitting there, wish her first, and then make a eye contact with every member, and just wish once or twice, good morning, sir. And you wait for them to ask you to sit on the chair. Okay. Just don't pull the chair and sit there. You wish them, and then you wait for them to ask you to sit. Okay, and then only you sit. Okay, then how do you sit? You sit very calmly, you sit straight, you place your hands gently on the lap the way the girl is sitting, right? Okay. Don't be cross-eyed, don't be fidgeting, don't be nervous, don't be biting your nails. Of course, you won't be. Don't sit cross-legged. Okay. Maintain eye contact, look directly into the eyes of the person who's asking the question. Okay, be very, very confident. You are a dentist any which way, and they are also a dentist. They might be an army officer, but they are also a dentist. They are your colleagues only. So colleagues or senior, I would say. So behave in that way. Okay, you are no less. Okay, be very confident in yourself. Okay, but during the interview, listen very carefully before answering. I'll tell you one thing. What happened was, the first thing that they're gonna ask you is to introduce yourself. This is the first question. Mostly, this is gonna be first question that they ask you. But never be prepared for this question. Okay, it's not gonna be. Sometimes what we do is, that I have told you that the introduction is going to be the first question. So you are sitting outside, you're preparing yourself. Okay, I'm going to say, for an example, I'm Sharanya and I'm this. I did my 10th from this area and my address is this. My parents' name is this. Don't pounce on the question, because what they generally do is, what happened with me is, once was he asked the question, the head of the panel asked the question, and sir then gave a very, like a very short pause. Now, I considered that end of the question, but the moment I started answering, he stopped me and said, boss, we have not finished the question. Okay, listen to the question first and then only answer. Okay, it becomes very embarrassing. First of all, that makes you nervous and gives you a hit. Okay, and even if that happens, you don't have to be like, oh shit, my interview is finished. I am done. Nothing's gonna go good from here. That doesn't happen, because then I qualified for the medical. Okay. So it is not the end of the story. You can always take the interview up from there. But my advice would be to listen to the question, take a few seconds of pause, make sure that the question is finished, and do not answer until unless they look at you and expect you to answer. They are not gonna cut your points if you answer a little late, but they're definitely gonna, I would say, watch if you pounce on the question. That tells them that you were pretty nervous and you just pounce on the question that you knew well. Okay. So, but mostly that'll be the first question. But in one of the interviews, when I was going during COVID, the first question that they asked was not not my introduction, but they asked about my mask. Okay, so this might happen. I won't say mask, but they might compliment you on your tie or maybe your shirt. Okay, so don't let that happen. Okay. Uh, and when you are giving the interview, answer very, very clearly. Don't be confused. Don't be in a hurry to end the answer. Be very, very, I would say, in a flowchart manner. Be very calm. Look at the pace that I'm speaking with. This is the pace that you're gonna have in the interview. Be very, very, I would say, in a flow chart, flowy manner. Okay, and a calm voice, confident voice, and look directly into the person that you are talking to. Okay. Okay, the kind of questions they might ask. Okay. So they might ask very motivational questions. They might ask you some psychological questions. For an example, why are you considering Army Dental Corps? I'll tell you this. One of the endodontists who went for an Army Dental Corps interview, she was already a PG and she went for Army Dental Corps interview any which way. And the first question they asked was, you are an endodontist. Endodontist is the, this branch is the bread and butter of the dentistry. You can do very well in general dentistry. Then why Army Dental Corps? You have to be very, very prepared for the question, even if you're not a PG, that why are you considering Army Dental Corps? And absolutely do not say, okay, there are not a lot of jobs outside and hence I'm considering. Always remember that Army is not looking to give you jobs. This is not a government entity that they are here to provide you jobs. They are here to select out smart individuals who are interested in serving Army. Okay. So your answer should contain anything related to being inspired by army, by the uniform, whatever it is, that should be there. Okay. Uh, of course, if you have a family background, don't say it directly. I would say, do not say, okay, my father is in army, so I went into the army. Don't say that. Okay, always say that I have seen the army culture as a child. I have seen it the way my father was raised by my grandparents, and the way I was then raised by my father. Then so I'm already inspired by the army, and I do not want to live my life any other way. So this is I would just say, just indirectly tell that okay, you have some army background, because that they might consider that. Okay, it's not absolutely necessary, but they might consider that, because I had a colleague who was there, and her husband was in army, and then also she was not selected at all. Her interview was the shortest. Okay, so do not be like, okay, my husband or my mama ji is in army. Don't say like that. Okay, you prepare this question thoroughly because this question is gonna be asked. Be very sure. Okay, of course. Academic knowledge, core dental subjects, recent advances, case-based queries, image-based questions. Recently, they have started image-based. They give you an image on the projector and then they ask you to look at the image and tell me what do you see, what is your diagnosis, and then the follow-up question would be how do you treat it? Okay. Core dental subjects, obviously, you have to prepare. You'll be asked questions like classification of RPD, I mean, cast partial denture, classification of the endodontic, some endodontic classification, some orthodontic classification. These things are definitely gonna be asked. So these are very core rote learning questions. So don't be like, okay, they have already tested me in NEET and they are not gonna ask any memory based classical academic questions. That does happen, and they will definitely ask you that. A question that I remember very clearly, that they asked me, What do you understand by tetany, and what is the difference between tetany and tetanus?" Which is a very common question that we were asked during our first year, right? So, okay, and then what is responsible? Which bacteria is responsible for what? So this is some question that you might be asked. Then you might be given some situational ethical scenarios leading to your related to leadership, teamwork, patient care under pressure, that you have two patients, one is suffering from this, one is suffering from that. Which patient do you care for first, or which patient are you gonna admit, and which patient are you going to leave? So these kind of questions will be asked. So clinical situations will also be asked. For an example, a patient who is suffering from cancer. Again, I told you there might be a long question, so be very patient while you're listening to them. Don't be like, okay, cancer, sir, I know what is there, chemotherapy, and then don't pounce on that. They might ask you, okay, the patient is suffering from oral cancer and he's lying, and then he develops maggots, and he comes to you. What do you do then? Okay. Definitely, I would ask you to focus a lot on core subjects like oral surgery and endodontics and prosthodontics more. But not only that, but main situations like core subjects more, because this is the situations that you might face while you're serving in ADC, right? So they are not going to ask you as a UG, ki, okay, tell me what kind of Leaford fracture would you do when you're planning for orthognathic surgery? They are not going to ask you that. They are going to ask you UG level clinical questions, things that you have faced or will face. Okay. Okay, some of them would be judging you psychologically. Some of them would ask you general questions. I remember that they asked me whether there's a new train which is being launched and has developed a lot of controversy, because at that point of time, Vande Bharat was having a lot of accidents with cattle. Okay, so they asked me what is the name of the train and what is the controversy that has developed around it. They asked me about cryptocurrency also. So be prepared for that kind of questions too. But there are not gonna be many questions related to that. I feel mostly three or four maximum. Uh, I would just ask you to read the newspaper, the previous day's newspaper, like 3 or 4 days. Do read the newspaper, especially the headlines, which can be asked. Okay, not murder news or something loot part related news. Don't read that. Something those things which are important for the country and something like that, maybe are something related to our foreign policies and things like that. Okay, do prepare. Okay, how to prepare effectively? I would just say that revise clinical basics, remember your Viva answers, because this is like a Viva only, in the sense the questions would be very short. They are not going to ask you long answer questions. So you don't have to prepare for that. Just review the basic Viva questions. Army related information, you should have the ranking hierarchy just in case they ask you basic things you should know, just in case they ask you. Okay, mock interviews practice, you can, or you it might help you out, practice with a sibling or something like that. I would just say that prepare your answers, the things that you feel are they are definitely gonna ask, like your introduction, like your hobbies. Hobbies is such an important question. Do prepare that, and especially about hobbies. For an example, I said badminton. Then the next question would be and was, okay, which is your favorite player? And I said a female's name, and then they said it's very strange. You do not have a male favorite player, and I said no. I don't, I haven't watched any male tournament lately. It has not come to my sight. I would say in the newspapers. I do not follow up very rigorously, but in newspapers I read. So don't be like that. Just prepare your hobby thoroughly. They ask me what is the latest tournament that the male team has just won. Okay, so this is the level of hobby question that they ask. So prepare your hobby, little bit of historical part, and main current. Okay, so current affairs is the main thing. Okay, maintain good grooming and formal dress. Please shave. Wear a very formal dress. I think they'll give you a dress code also. Ask you to wear a white shirt and a black pant. If I'm not wrong, get a smart white shirt and a black pant of good fitting. You should appear smart. You should sit smart. You should sit straight and very confident, and that helps you out. Your hair should be proper, you should be clean shaven. Girls, for girls, I'll ask you to be either form vestal formal or be in a sari. I would say do not go in a suit, although I do not have personal experience about it. But people have told me that they do not consider suit in a formal dress. So uh, preferably you wear a sari. Okay, but be confident in that. If you feel that, okay, you might fall in a sari or something like that, go for a Western dress. That is okay, but it should be formal. Okay. Be honest, be calm, be confident. And if you do not know the answer, the best thing that you can say is sorry. Sorry, sir. I'll look upon to that. I'll research it more. I'll dig deeper, sir. Be totally unafraid of being sorry. Don't try to, because they would know that you do not know the answer. If you try to make a jalebi out of that answer, they will know you're beating around the bush. You do not know the exact answer. Just say, I'm so sorry, sir. I At this moment I cannot remember what was the thing, but I'll definitely read upon it. Okay, that's okay. You might feel at a point of time, you might feel okay. I have said sorry a lot of time. Maybe this question I'll try to, although I do not know the answer correctly, pinpointly, but I would like to roam around. If you're planning to do so, if you do not know the pinpoint answer of the correct word, you can always say ki, sir, I do not know the exact answer, but this is what it is related to. The concept is this. The exact word, the exact term, I cannot remember as of now, but the concept around is this. This might happen, and you can always say that before you start answering. Okay. They might say, okay, tell me whatever you know about it, and then you can go on. And they might again say, ki, oh, you are nowhere close. Then also it's okay. Oh, sorry, sir. Then I'll read upon it. That's okay. Always be unafraid to say sorry, even if they're asking you 10 questions and you answer just one and say sorry for the rest of them, is much better than trying to fool around the panel with just answering two questions correctly and three questions you try to fool around. Don't do that. It is better that you say sorry. Okay. So, my final thoughts would be show officer-like qualities. This is what they are judging for. You have already qualified need. So academic per se, they understand that you might not know every questions, but you have qualified need and you are well prepared for it. Your academic background is strong. You might not be able to answer this particular question, but obviously your background is strong. What they are looking for is whether you're honest, disciplined, you show qualities of a confident, empathetic person. Okay. So just be honorable and dedicated. And at when you enter, you are not just a dentist, you're a soldier first, right? So an officer. So yeah, this is about it about preparing. One extra thing that I would like to mention is if you do not have knowledge about this, but there is one more thing. This interview is for short service commission. There is some age limit in which you can give permanent commission exam. Be thorough with the circular. You'll get to know. And if you qualify for the permanent commission and then you qualify the NEET again, you can always do PG, and they get you a good government college, and you can always do PG after that, after you have entered the Army Dental Corps. Okay. So yeah. And for as to the medical that you're gonna face the next day, your medical would be everything, starting with your dental examination. Then you'll go to the hospital. In hospital, you'll be going through ultrasound, then ECG, and your eye examination, your ear examinations, whether your hearing is proper or not. Your thorough surgical examination, a general surgeon will observe whether you have knock knees or whether you have flat foot or not. Just preparing you beforehand, you might be asked to remove your shirt and a pant when you are going for a general surgeon examination. But apart from that, nothing to be scared of. They are gonna check you for sinus and things like that. Okay, so basically a cardiac examination, renal examination, a hepatic examination, your and then your basic tests of eyes and ears. So yeah, nothing scary about that. You anyway, you can't prepare for the medical examination, whatever it is. That'll be there. You cannot, you might or you might not be able to correct that. So yeah, I would say all the best and do very well. Remember the things that I've told you, and just be confident and not be scared. Okay. I hope you guys get selected and go through it. Okay, I hope aren't any questions from this. Uh, so I think,
Yes. Hello.
hello. Yes,
Yes.
yes, sir. Tell
Uh,
me.
Good evening, sir.
Good evening. Your voice
Can
is breaking.
I ask some question?
Sir, your voice is breaking. Wait a sec.
This
I couldn't hear you. Just can you just type it on the message box so that I can see what you want to ask? Uh, is there anybody else who wants to ask any question? Okay. Okay, Sujay, I think, sir, that you have to refer to the circular which has come up. They often they write the qualifying age for that. You can always refer to the previous circular or the next one. As far as I understand, it is still 40 or 45. I'm not very sure. I do not remember it correctly because age was never my problem that at that point of time, but is in the circular it's clearly mentioned. The dress code also, the people who are asking about the dress code, that is also absolutely mentioned when they get a this thing mail from them. Once you submit your forms, those who are selected, a list is given. Okay, there is a list for the people who have qualified. You also receive a mail about that, and in that mail, the dress code is clearly given. It's mostly white shirt and a black pant, and for like for the males, it is like that. Uh, but again, it's mentioned, always mentioned in the circular, so you don't have to rely on me for that. Okay. Okay, the achievement that you're, okay, this is a very important question. The achievements that you have mentioned, you need not carry the certificates. I told you, right? They will not allow you to carry the certificates apart from the circular the mail that you'll receive. You'll receive a list of documents that you need to get. Okay. If so, you take only those documents because they won't consider it anyway. If you want to mention some like one of your achievements, then you have to mention it indirectly. Like, I would say, for an example, they are asking you about your hobby and you want to mention that you were a national player. Then you always say it like, okay, sir, my hobby is badminton. I got involved in it as a child. I won my state and then a national. So basically, yeah, that became my hobby any which way. So, and if it is academic in nature, for an example, you have uh, published something, some paper or something like that. You have one seminar, you have one in a, I would say in a conference, you won something in a conference, then you can always say that, mention it indirectly, not directly while you're sitting in the interview. You have to find a way to mention it indirectly that, so why you are planning of Army Dental Corps. So, or they might ask you that, why did you get into dentistry? And you could say, Ki I always wanted to get in one, and then in first year I won uh, prize in the conference as a best paper that encouraged me further, and that pushed me towards dentistry and gave me a push. So yeah, so indirectly you have to mention. You don't have to. You have to be smart with it. Okay. No, suits, if like suit, you mean the coat and pant? I don't think so. They'll mention the dress code. Suit is not necessary. A shirt and pant would do. Don't overdo it. Like if it's winters, and again, I would say just stick to the dress code, whatever is mentioned in the circular that you get. Okay. I would advise you to keep a tie if it is required. Otherwise, if it's mentioned, otherwise, just stick to whatever is given. What are the questions related to that? As for example, late for applying, what can be the best answer? I mean, a logical answer. Okay, why you got late for applying? No, in the circular, but you might have, DPS, you might have received a mail regarding the clothing. Check the main circular with all the details that you got, in which interview things are mentioned, or just check the mail that you got. Okay. As to Sujay Singh, sir, well, it will take some time for me to think of a reason, a smart reason as to why you didn't apply before and you are thinking of applying after so many years. I would just advise you to it should not appear as a disadvantage or a mistake that you did. It should be a very smart decision, that why you are giving interview so late. Uh, so you can always say that I didn't feel I couldn't qualify I tried before, but I couldn't get the rank. And this time I always wanted to get into army, and this time I had to really prepare myself, and luckily with the grace of God I could qualify for the ADC interview, and that is why I'm here. I am looking forward at this age also. I want to serve army. I understand that I might not be going for permanent commission, but then I want to serve army as much as I can. So it should be like that, something like that. Okay. Okay, how many people as to will get selected? Uh, Shiny, see, it totally depends. It totally depends. It's not as if, see, I told you the calculation before also. It's not like, for an example, there are 30 vacancies. And you'll mostly they publish the list of every day, who all people are coming, right? They publish the list. So the list, I'll assume that the list contains like if there are 30 vacancies and they are calling into 10 and it is a 10-day list, then 30 people will be called. But it is not necessary that every day 10 people will be selected. It totally depends. It totally depends. Uh, they might take 6 7 a day, and the next day they might take 13 if they feel that okay, if this person is this batch was really good and all these people did really well. I mean, it also depends upon your luck. They might be, if you are on the last day and they have already selected, for an example, uh, I mean, just 27 people remain. I mean, just 30 people remain, and they have, for the medical selection, there's just 7 people remain. Then only seven will be selected the next day. So 7 or 8 maybe, if they go beyond one or two beyond the the range. But mostly 7 people will be selected. So it's hard luck also. It's totally on your luck. But yes, if you are better than everybody, then you'll be selected. But always remember that that evening only you'll get to know. Yeah, do not see whatever you do, do not uh, tell anything about you which tells you that which tells a negative part of you. Okay, even if they ask your weakness, you have to tell it in a way that that becomes your strength. Okay, maybe you can tell, okay, if they ask you your weakness, okay, you might say that, okay, if I face a problem, then I have to tackle it. Mostly tackle it and be on it till I find a solution. And mostly, I find a solution to that. But yes, I do get sometimes, it has to be a advantage in a form of weakness, right? That I always apply my mind to smaller things, which might not be important to everyone, but it is important for me. In that also, I pay too much attention. I feel sometimes that I give attention to smaller things also, apart from so I give importance to details as compared to shallow preparation. You might say that okay, I'm no you understand what I'm trying to say. Okay, it has to be a strength in a form of weakness. So yeah. Yeah, job security. Don't say job security, okay? That's not gonna work. That's not gonna work. Absolutely. You have heard the army chief saying that we are not here to give you jobs, so that is not how it's gonna work. So yeah, but Sujay, I feel that you should be very, very prepared with this answer because you're definitely gonna be asked about this question, and you have to answer very, very smartly. Otherwise, your interview might be over then and there. Okay. So because I've seen the just two questions, like that's what I heard. Just the two questions were asked to my colleague who was an endodontist and nothing more. The moment she couldn't answer, I believe that I was not inside then, but I believe that she couldn't answer the question of endodontist. Why are you applying for ADC after completing your MDS 2 years in conservative and you are here to apply in the ADC? Yeah, might you have to be very, very good in answering because some what happens is sometimes they are looking for a person that they might be looking this time for an oral pathologist because a lot of oral pathologists have retired, or an orthodontist because they have developed a new building. They are working towards a treatment and they need orthodontist or they need prosthodontist for so it totally depends upon the demand also. But yes, so it is bit on luck. uh, Anything else, anyone? Okay, okay, Shaurya. Thank you so much for your attention. And yes, all the best. Do well. I hope I see you as a ADC officer soon. Okay. All the best. All the best, guys.
Yes, sir.